Good morning, everyone. Thank you for joining us for the NIH Data Management and Sharing Policy for Non-Data Librarians. We're pleased to welcome this month's speaker, Dr. Nina Exner. Dr. Nina Exner is the Research Data Librarian at Virginia Commonwealth University in Richmond, Virginia. Nina serves both the medical and non-medical campuses of the VCU. In that capacity, Nina advocates for data as closed as it needs to be and as open as it can be. I really love that saying. Nina has occupied national service roles in the NIH DMS Plan implementation period, and these roles have included being the inaugural NNLM National Center for Data Services Ambassador and co-chairing the DMP tool working group on the NIH DMS Plan. Nina's work emphasizes interprofessional collaboration with research administration and research development teams and technology professionals to support researchers and their data. So thank you so much for being our guest speaker this morning, and I will turn everything over to you.
Thank you so much, Katie. Can you see
Yes, you're good.
my slides? Excellent. Well, thank you all for coming for this session on the DMS policy for non-data librarians. I'm going to try my best. Being a data wonk, I don't always aim right at the right spot, but feel free to put a question in the chat if I go a little bit too data nerdy and don't explain my terms. As Katie already mentioned, I'm Dr. Nina. I'm at Virginia Commonwealth University. And most importantly, I'm happy to chat with you, either just with you individually as you're developing policies or practices, or to talk with you and people in your Office of Research together. I do work with research administration staff a whole lot about the policy and policy implementation if you find that you want to kind of have someone to bounce your ideas off of. So I'm always happy to chat. I haven't had that many requests for that this year, but last year I was doing a whole lot of that. If you're finding that you're getting more requests from your faculty to talk about the DMS policy, please feel free to let me know. I'd be happy to help. To try to keep this at a basic level, we're going to talk about, I think by the end of this, you'll be able to say at least two ways that the new policy is different from the old policy. That may be a little obvious at this point, but faculty researchers, sometimes if they're the kind of researchers that only get one or two grants, it may take 3 to 5 years between their grant applications before they encounter a new policy. And so it's going to be a couple more years that we're still seeing faculty saying, I've never heard of this new policy. What are you talking about? So a couple of things that you can highlight that have changed for those faculty. You're going to be able to name the 6 elements of the NIH DMS plan, which I can do in my sleep at this point. And you'll be able to use the NLM's repository search page to look for some domain-specific repositories for your researchers. And that's really probably the biggest value add that we can provide to people. I'm going to drop a PDF of these slides. It is not Section 508 compliant. I did not go through and check all of the little icons and stuff and make sure that I had put alt text or decorative flags on them. I apologize. All right, so the data sharing policy that we had until the start of last year, and the one that a lot of faculty still think of as the data sharing policy. A data sharing plan had to be entered into a research proposal that was requesting $500,000 or more in direct costs. So largish, medium, and large types of research proposals. Or grants. Research proposals is the technical phrase for grants, as in grant writing. That plan had to talk about how the final research data would be shared, or it needed to have an explanation of why data sharing wouldn't happen. That part is still accurate for the new policy. And sharing could be through any method that the PI described, unless the institute or center and you're going to hear that as IC or ICO. Uh, here, here comes my co-presenter, Blackberry, who is determined to be seen. I hope he amuses you. Institute or center, as in the National Institute of Neurology, the National Institute of Mental Health. So the institute or center indicated a specific sharing approach, then they had to use that approach. But otherwise, the PI or faculty member, the researcher, could describe whatever method they had. And the infamous email the researcher for the data was very common and was allowable under that policy, but it isn't now. The new policy, for any submission on or after January 25th of last year, that will produce scientific data, any submission that will produce scientific data, not any submission asking for $500,000 or more, but any submission that will produce scientific data. Two things are required: submission of a plan outlining just how scientific data and any accompanying metadata will be managed or shared, taking into account any potential restrictions or limitations, and compliance with the awardee's plan as approved by the NIH ICO. That's Institute, Center, or Office. Like I said, it's the National Institute of Nursing Research. Yeah, NINR, Nursing Research, or the National Center of Translational Science something. There's another letter in the translational science one, but the institute or center that they're going for. So only two things are required. Let me take that apart though, because there's a lot packed into those two things being required. First, they have to have a data management and sharing plan. The second half of this webinar is going to address what that plan looks like. That's usually what people are being asked for right now. Two, it has to address how the scientific data and metadata will be shared. So this focuses on, when they say scientific data, they really mean the digital data. So something that can't be shared by download, if it can't be sent through the internet, it's not going to be affected by this plan. But it did say and metadata, and metadata is explicitly called out throughout the plan. That can be technical metadata, like setting information on instrumentation, which comes out automatically, or it could be human-made metadata, like documentation for the data, the code book of the variables and that are measured in the spreadsheet that they're sharing, for example. Metadata can go from fairly simple documents all the way up to super, super complicated. There's no rule that it has to be super complicated metadata. It just does have to include discussion of metadata as well as the data. That's also new. So I said the digital data, not physical data, was affected. Let me give you a couple of examples of what is meant by data. It can be a little fuzzy. So if they're doing surveys and they start with paper surveys, that is definitely not affected. The paper part, the paper stage, if they're doing observations of an emergency room and patient behaviors in emergency room and they're doing clipboard, tick marks, or something like that that's in hard copy, that's not affected by the data management and sharing plan. They don't need to address that. When they type those survey results into a spreadsheet or form, yes, at that point, that's become data for the purposes of this plan. So the data management sharing policy applies as soon as they type it into a spreadsheet or data entry form on a computer. They're going to then clean or transform, that is, take things that don't look right on the spreadsheet or didn't get entered correctly. They're going there's a whole process that we call cleaning and transformation, which is squishing data around on the spreadsheet or cleaning up how the images look or whatever. And that it's still data for the purposes of this policy throughout that process of adjusting it and preparing it for final analysis, up to the final analysis of actually statisticizing it, taking it, whether they send it to a biostats core, whether they do the statistics themselves. All of that data through cleaning, transformations, changes, and analysis is affected. The publication stage is not affected by the data management sharing policy. The article itself is not covered by this policy. They could choose to include the results, tables, and graphs as they look in their final form, depending on where they're publishing, what the license is. But they don't have to share what's going to go in publication. Now, that doesn't mean they don't have to share it as part of their data sharing. There is still the public access deposit of articles in PubMed Central. That's still a thing. It just doesn't go in the data management and sharing plan. And it's worth noting that PubMed Central process is also under some evolutions right now with public access rules. But that's separate from this policy. Let me give you a slightly more sciencey, technical. If you don't work with basic scientists, you might want to tune this part out. If you do, though, this may be relevant because it's a little bit more, it shows a little bit of the fuzzy zone. So wet lab stuff like Petri dishes, antibodies, blood samples, that is definitely not part of the data management sharing policy or plan. I'm not saying that's not some kind of data, but it's not data as defined under this policy. Bedside charts, physical bench notebooks, anything like that is specifically excluded. If they make instruments that have physical outputs, like actual physical Western blot gels, if you don't know what that is, don't worry about it. It's just part of a scientific process. Or spectra that give a physical tape that comes out with it going, or any of those kinds of things. That's probably not, if it's physical, part of the policy. If it's a digital image of a gel, they could choose to address that, though. So this is a fuzzy zone because some instruments are still physical and some instruments create digital outputs, and that makes it a little bit like tough. The quantification stage, which is a fancy term for typing it into the spreadsheet. So if I've got a little Petri dish and I'm comparing how big did my cells grow, and they grow this big on one Petri dish and this big in another Petri dish, and I'm measuring it on my microscope with a tiny caliper or something, and then I'm typing that into a spreadsheet or form, as soon as that happens, it is definitely affected by the data management and sharing policy. So that term quantification is a nice technical term for for working with your basic science folks. If they type it, as soon as they measure it and type it in, it is definitely part of the policy. Then again, the process of cleaning it, transforming it, and preparing it for analysis, that's all definitely affected. And then through the final analysis, they can, all of that up to the final analysis is definitely part of the data management and sharing policy. And then again, the publication itself is not. They could choose to share the graphs sort of independently of the publication, depending again on the policies of their journal. Going back to my taking apart the little 2 paragraphs, you only have to do 2 things. The next thing is managed and shared. And when they define what managing and sharing is, they specifically say established repositories. Managing and sharing data is no longer something that should be done by email, because it's been just amply demonstrated that if they've got it on if a faculty member has it on their laptop, and someone emails them 7 or 8 years from now to ask for that data, that laptop is gone. Most faculty can understand it if you explain it that way, that like contact the PI isn't a long-term strategy for getting hold of data. So it really needs to go into repositories. So the plan needs to summarize what will be shared and the where should be in an established repository, which I'll get back to in the second half of this workshop webinar. It doesn't need to go into the kind of deep level of security about sharing, though, that goes into an IRB protocol or a data safety and monitoring plan. Allow me to mention that sometimes people will try to send the library a data safety and monitoring plan instead of a data management and sharing plan because DSMP and DMSP are very easy to confuse with each other. I can't imagine what the NIH was thinking. It's really, really easy to confuse these. If someone sends you a data safety and monitoring plan, you ship it right back to them and say, this is not what I do. DMSP is me. DSMP should not be. You will know if you have the qualifications to write or review a DSMP. There is no non-data librarian or even data librarian typically that should be involved in that. I can think of the data librarians I know that do DSMPs on a pretty short list. It does mention taking into account limitations. If data cannot be shared, the researchers should be able to specify an ethical, policy, technological, or legal reason, and they can explain that in the plan. They still have to write the plan, but they can say like IRB policy contradicts being able to share this data. They can't just write any reason. And we have heard from the NIH in the past years, they've been going through like things they don't like about the plans they're getting, that not giving good detail on these limitations has been a problem. So they really need, the faculty really need to kind of step up their game on saying why they can't share if they can't share. And not just saying, I can't share for human reasons. They need to be a little more specific than that. Oop. So let me try to sort of give a sense of what that might look like. So imagine a library survey, just trying to make this familiar. Imagine I'm getting a little NLM grant and I'm giving out a library survey and I'm asking practitioners to talk about how they use evidence in clinical encounters. Since there's 80 of us here, I'm not going to ask you to actually put that in the chat, but think for yourself for a moment while I take a drink of water. Are there limitations you can imagine that might be an issue here, ethical, legal, or technical? Uh, Compliance and all data produced. I'm gonna have to come back towards the end to the two chats that were in there. Right. So the biggest limitation, I see someone put it in the chat. Don't all spam the chat though, because I do want them to be us to be able to find the questions that are in there. But an excellent point. If there's any kind of patient data collection or even anything that's about clinical encounters that might hint at it, that would be an ethical potential limitation. And then that's going to be the top one. Let's also pause to reflect on what might some metadata be. Now, there may be lots of different metadatas. Data wonks like me will talk about README files. There could be protocols for data cleaning, but the most basic metadata that might go with this would be either the human written data definition. So I've got a column that says pat type. What is pat, Pattype? What does that mean? Well, I should write down pat type equals patron type, which can be in the categories of uh, clinical faculty, resident, internists, etc., or whatever categories of patron types were allowed. I might also want to just PDF that form and questionnaire so people can see exactly what was asked. Both of those things are not data. They're not data in the sense of stuff that's going to go into the pie chart that I would generate. They're metadata. They're information that tells me about that data. So that's a very common type metadata to go with survey type data. All right, so then if you look back at that really short thing I said, there were really only two requirements: submit a plan and follow the plan. The hard part is writing a plan that could be followed and get approved. And that's a little bit of a tightrope between what I think is robust enough to be approved and what is not so detailed that I can't follow it. What is broad enough that I can follow it or my faculty member can follow it, because it's got to be realistic. So check whether you're still following me. This is going to be a yes or no question. You have a faculty member submitting an R21 grant. This is usually how they email it to me. I'm submitting an R21 grant to the National Institute of Arthritis and Musculoskeletal Skin Diseases. And they send me that on October 16th of 2023. They plan to give out monthly surveys to interns and site supervisors about the students' process of learning to talk about and palpate, or even just touch in some way, severe burn patients. Do they need a DMS plan? Well, you think about whether that's a yes or no. The one I just saw pop up in the chat, if a grant has a poor DMSP, it will not get rejected this year. I ain't saying what's going to happen in the future, because NIH could change this, but this year it will not get rejected for the quality of the DMSP. They probably will get information on how to improve it if the DMSP is rejected. And I'll go a little more into when that happens and what that looks like later on. But that was a easier question to answer than the other ones. Okay, you've thought about this and hopefully you've come up with, yes, they do need a DMS plan. Now, that DMS plan may say that because of FERPA regulations, we're going to be talking to students and it's involved in their grade and we can't share data. That's going to depend on the design of the study, whether they can or can't. They need a plan, even if the plan is that they won't be sharing much. So I'm about to give you a grant timeline. This is the way that I explain the process to faculty, Office of Research staff, postdocs, PhD students, and so on. It's full of jargon, and if you don't like it, then I totally understand that. I just want to share you how I describe this to those staff. It may not exactly match up with jargon that you would use, though, and that's okay. But this is how the Office of Research will talk about it. And so I just want you to hear how the Office of Research, the grant-focused jargon works. And there's also some links in the slides if you want a little bit of help with grants jargon over time. All right, so the way I explain it to them, at proposal submission stage, that is to say when they send in the grant to the NIH, a DMSP must be submitted as part of the proposal. There's a new section in proposal submission specifically for the DMSP. So the proposal structure has changed a tiny bit to make a new section for the DMS plan. After you've submitted, if you make it to just in time, yay, you made it to just in time. The just-in-time document stage is when you will hear back from the NIH staff about how they have assessed the merits of your DMS plan, and the NIH staff may ask for changes. Please note that this is not going to be part of your grant score. Now, that's how I would say it to my faculty. What that means is, well, after months and months after they've sent the grant in, if their grant reaches a certain quality of review, then they'll get back just in time document requests. That's when they submit their IRB, and also when they may get feedback from the NIH staff, people that work at the NIH but are not peer reviewers, about DMS plan good and bad points. They may demand revisions, and a lot of times they don't get a lot of time for this. Saying it's not part of the score, though, it means that it's not graded by the peer reviewers who say this is a great grant or this is a terrible grant. The only thing that can keep them from being accepted based on a data management and sharing plan is if it's a data generation grant that specifically talks about data sharing. That's a very tiny, tiny, tiny case. Most researchers will just hear back from the program officer saying, your DMS plan sucks. Here's all the things I need you to change about it. And you've got a week to get it back to me. So it's not, it'll block disbursement of the grant, but it won't give them an F on the grant. And telling faculty that it is not scorable or it's not part of their score usually makes everyone go, oh. Now, that can be a little bit too much for you because sometimes that means that they just don't want to pay attention to it at all. But it is what it is. All right. So the next thing that I would tell my faculty and research office staff, at the post-award stage, if you get awarded, yay, you got the grant. During post-award, as plan revisions become necessary, your data management and sharing plans should be updated by you and reviewed by the NIH IC Institute or Center staff in your annual RPPRs or your annual reports. Make sure that you talk to them about any major changes to your data management and sharing plan because, oh, wait, I'm sorry, because they will check. But before that, keep in mind that shared data is going to have to be made accessible no later than the time of an associated publication or the end of the award support period, whichever comes first. So at closeout, they're going to want to know if you shared your data or not. And if you publish a journal article before the end of the grant, then that needs to have some shared data shared with it. So whichever comes first. You can't just wait for publication, though. So if you don't publish until after the end of the grant, you're going to still have to share data before then. That's really going to be tough. I'm so sorry, researchers. That, by the way, is one of the big sticking points and big culture changes here. All right. What I then tell them is by closeout's the technical term for the end of the grant. You have to have a final report on your compliance with the awardee's DMS plan, the way it was last approved. Remember when I said that if you need to change something, you should really change it? The last way that the DMS plan was approved is the one that you're going to have to comply with. So if you're not going to be able to comply at year 5 and you realize that at year 3, you should really fix that. We haven't really gotten any guidance on what that closeout plan is gonna, closeout report's gonna look like yet, though. Please note that post-closeout, any storage fee or action that you have planned for after closeout has to have been paid for before closeout. Once your grant's closed out, you can't pay for nothing. So you can't say, I'm going to pay every year for 10 years for data storage. It has to be something you can pay for in advance before the grant ends. All right. So that's how I describe it to researchers and grant staff in Researcher Ease. Let me pause for questions. And let me go back and look at the questions that I put on pause earlier. Um, how do you document or demonstrate compliance? We don't exactly know yet what that's going to look like. Um, and it's kind of tightly connected to a question of oversight, which I would be cautious about committing to document for faculty. I suspect they're going to have a link that they share in their final closeout, their final report that's going to lead to a shared data set. But that's only my guess. We don't know yet because the proposals written last year won't be demonstrating compliance for 3 to 5 years. So, um, does policy refer to all data produced from a proposed product or data produced that ultimately results in publication? In between, they do want, the NIH really wants to see data that is a null result or not significant enough to publish about. They want to see that starting to be shared. That's one of the big motivators here. But it doesn't necessarily have to be all data. All data could be a lot of stuff. There could be a lot of sort of background garbage or just huge images or videos or something that just isn't practical to share. So it may not be all data, but it's what the researchers call all endpoints. So like any big outcomes that they talk about, even if those out in the grant, even if some of those outcomes turn out to be not significant statistically, still probably should be planned for sharing. Um, you'll hear a little bit more about all data versus data to be shared in a minute. All right. Feel free to keep putting questions in the chat or in the Q&A if there is Q&A. And I'll get to them at the end. But let's see what the plan looks like. What is a data management and sharing plan anyway? It's a supplemental document. There are a lot of supplemental documents that go in with the grant. So there's like the grant, and then there's a mazillion of other documents to go with it. One of them is this data management and sharing plan. They recommend 2 pages, but it's not actually required, which is good because a lot of them are longer than 2 pages. The plan covers 6 elements, which I will go over in a moment. And it is, as you already heard from me, it's not set in stone. It's supposed to be adjusted first during just in time, award negotiation stage when the program officers will look at or other staff will look at it and say this plan's good, this plan's not good. And then it should be adjusted again during the research if expectations change. I thought I was going to have 100 mice, but it turns out I'm going to only have 80 mice because it turns out that I need a special strain of mice breed for this. I don't know. I don't know much about mice and uh, animal-based research, I'm afraid. But if big adjustments happen that will affect the data sharing, that should be adjusted over the course of the project. Some areas that the librarians can help with. There's basically 3 skills that I think overlap here. One is the reference interview, and that's the one that I personally depend on the most. One is metadata and information description, the ability to read documents about how to document something and explain them to other people. And then digital preservation and archiving is really what underpins all of these repositories. And so all of that, all of our archivist colleagues, really, they're the ones who understand what's going on with this. Public-facing people like me, I leave it off at the end of talking to the faculty member. So those are all really valuable skills to have. During the reference interview about plan authoring, here are some tips, or when you're talking to a faculty member about their data management and sharing plan, here's some tips at that consult. Go through the plan one section at a time. Don't let them try to squish it all into one paragraph like the old format. That's what they may be used to, one squished paragraph. But really, best to go through all of the elements of the plan and make sure that you've discussed them clearly. Gently steer them back to the topic because they don't want to talk about their data. They want to talk about their research, and that's not quite the same thing. So you may need to gently get them back very much like trying to get people a little bit back towards their subject headings and not talking about their big picture thoughts, but getting them back into the department of what we're really talking about today, even if it's not what you really would prefer to be talking about, which is your science. So that same sort of experience that subject specialists may have of trying to help get from the big PhD type thinking about I've got all my science floating around in my head. What? Subject headings, keywords? I don't really know what you're talking about. But the science, it's so cool. Gently getting them back to whatever is being prompted in that part of the plan. And then think pragmatically about what are things that can be checked by the NIH. So it's going to be really like I don't want to say dumb it down, but don't let the faculty overthink it. What kind of file types are their data going to be shared in? Is it going to be an Excel spreadsheet? Is it going to be a Stata file? Is it going to be a MATLAB file? That's something they can look at real quick that could actually be checked. They can open the file and say, faculty member said they were going to share 3 spreadsheets. I see no spreadsheets. That's something that they could really like check off or not check off. It's easily checkable. That makes me imagine that it's probably going to be an important point. What repository is it going to be on? If they say dbGaP, is there a dbGaP link? dbGaP is a big genetics and genomics repository. It's my usual go-to for an example of a repository, but clinicaltrials.gov, whatever. I want a link to, you said you were going to link me to dbGaP. I need a dbGaP link. That's something that can easily be checked off. So I'm assuming they're going to want to check that sucker off. And then what kind of persistent identifier? Are they going to get a DOI? Are they going to get a dbGaP accession number? Are they going to get a clinical trials.gov CT identifier? Are they going to get a PMC ID? That's the kind of thing that can easily be put into a closeout report. So I'm assuming they're going to want to see it. And those are things that faculty members just have trouble remembering to keep in mind. They're thinking science. I think the science is going to be part of it, but only to a little bit. They're going to want to really see like, is their data, does it have a DOI so it'll still be available in 10, 15 years and still when link names have changed, and have they actually put it in the repository that they're named? There's 2 main places you can get this outline from. There's the DMS plan format page, link is in the PDF. And there's the DMP tool. Probably, if you're a non-data librarian, you want to give the optional DMS plan format page to the faculty member as where they should be starting. And honestly, you should be familiar with that page because that's where they will have started or where the grants office will have sent them to anyway. So you want to know what that Word document that breaks it out into sort of basic prompts for sections and subsections. You want to know what that looks like, because that's probably what they're going to start with. The DMP tool is a free website. It's a little more cumbersome to use than the Word plan, but it has a lot of advice all in one place. So you may want, even if you don't have them write their plan in the DMP tool, it's free. You could just sign up for it. You don't need to have a special affiliation or anything. You may want to go into the DMP tool and start a tests plan so that you can see the advice that's in there, because that advice can be really helpful. There's a lot of curated guidance and suggestions in there. So it's a little cumbersome to try to send your researchers through, but the advice may be helpful for you to look at as you're going through their email and saying what is good and bad. It may be helpful. This is what the DMP tool looks like. So it's got each section in a sort of text box, and then it's got a guidance box on the side. You can put local guidance in it as well. You see this one example of screenshot has VCU as a tab. So you can say, we recommend this, that one. There's 6 sections or 6 elements. You don't have to have them as sections, but it's usually easiest to write. Most plans, especially as you're starting out, just in 6 sections to reflect the 6 elements. This is the long version of how data type is written. A summary of the types of data to be generated, a description of which data will be preserved and shared, and a brief listing of the metadata are the important part. Not important, it's all important, but the parts that I would suggest focusing on. How much data will be generated, how much out of what is generated will be preserved and shared. So they understand that there may be things that just aren't practical to share, especially if the faculty member is working with images. And then metadata and associated documentation. And in the Word document that was on the left side of the 2 ways that you can start working on this, this is broken out as sections 1A, 1B, and 1C. So they explicitly hit these 3 areas. In discussing with my researchers, I emphasize that they can indicate the level of aggregation and degree of data processing. So if they're going to have to de-identify it because of human subjects, they can say, I'm going to have to de-identify this for human subjects' privacy. If they feel like the detailed data would be too big to share, it's just a bazillion variables and a bazillion participants or something, they may need to aggregate it, or if that's the best way to make it private or protect intellectual property or something. So aggregation is discussed as one of the things that can be described in the policy. So here's an example of a real-ish email that I got. A cancer genetics researcher tells me they're going to collect 300 patient conditions and 300 surveys of patient conditions and patient outcomes. The survey is going to include a survey of patients' views. They tell me that it's going to have the genetic barrier scale. They're going to supplement that data with health records data. They're going to collect family histories and conditions. They're also going to survey the providers of those patients using the Phoenix Toolkit measures of genomic medicine readiness and practice. Can you imagine what my first interview question when I got a hold of them was? Is that going to be in a spreadsheet? I really did. The first thing I asked them was, like, that is all good, and I'm not saying don't include that in your plan, but please add, are you going to use a spreadsheet or are you going to collect it in some other kind of file? Turns out they're going to use it in REDCap. That's a sort of HIPAA secure equivalent of SurveyMonkey. But they said, oh, but I can just export it to an Excel file for sharing. Great, plan made. Collect in REDCap, talk about how it's generated there, share in Excel as a spreadsheet, talk about how that's generated there. Excellent. So that's the kind of sort of guiding them gently onto topic that I mostly do. The next things I have to ask are a little bit more complicated and data wonky. Discussing with them whether individual level data is the right thing to share or whether aggregate data is a better choice. So are they really going to need counts and averages and standard deviations and frequencies of responses or other kind of squished together data? Or is it more appropriate to their colleagues and to their discipline to have all 300 people's worth of data? Um, and if they think they would prefer to aggregate, and a lot of them, their first instinct is, yay, aggregation. Can they really do that by the end of the grant? Is that feasible, or are they still going to be munging data until years after the grant is over, including endpoints that aren't statistically significant and might not normally be published because those unpublishable results are very important to the NIH. So these are things that I usually want to talk to the researcher about. And this is easier if you're a subject liaison. I don't always understand enough about the science to do this effectively. So, collaborating with my subject liaisons on this, and they may not always understand the data parts very well. So, a lot of times we like to work together. It's a great opportunity to work together if you happen to have a new data librarian and a subject librarian that can work together on it. Element two, related tool, software, or code. They'd better know if they're making code or not, and they should be able to address this themselves. I might get into it with computational researchers, but at the beginning of the at the beginning of this, when I started getting these requests a year and a half ago now, mostly I was saying like, can you say whether the data will be available in common formats like spreadsheets and Word documents, or it's going to be in this commercial format like MATLAB or Stata or SAS? So this can get more complicated, but mostly this is on the faculty, not on you. Standards element three is really deep and really complicated. The technical terminology is what's here in these bullets, an indication of what standards will be applied to the scientific data and associated metadata. And they say in the policy, many statistic fields, many scientific fields have common data standards and others do not. If there is not, the plan can indicate that there is no consensus data standard for the scientific data and metadata. So if the faculty member says there's no data standard, if their discipline uses a data standard, they should probably know it. And it's not necessarily your job to know it. Now, subject specialist data librarians or liaison librarians who really want to develop an expertise in this might get deep into a specific discipline's data standards and metadata standards, especially. But that can take a lot of time and a lot of deep expertise. So I think it's safest to say, like, to remind them to think about, is there any kind of data standards that you talk about when you're sharing data in your field? But if they say no, then they can indicate that there's no consensus standard. And if their program officer says, I really want you to use the National Cancer Institute's standard on blah, 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 that's for them and their program staff to discuss, because that's probably going to come out of the Institute. If you want to dip a toe into this, if they use a specialist repository, not a generalist repository, which we'll talk about in a moment, you might be able to say the data and metadata will align with NCI image commons data and metadata structures, or data and metadata will align with clinicaltrials.gov data and metadata structures, or dbGaP data and metadata structures. So you might just throw in the standard of the repository. But otherwise, I'd be very cautious on standards. And generally, it's not that librarians can't help with that, but it's going to be the more specialized skill. Element 4, data preservation, access, and associated timelines. has more or less three components: the name of the repositories where the data and metadata will be archived, how the scientific data will be findable, identifiable, and when it will be available to other users and for how long. That's the official phrasing. This is where we really shine. And that's good because none of the researchers understand it. I'm not quite sure why, because it seems kind of straightforward. Probably librarian brain. They need to share in a real established repository. That can be a lot of different repositories, but starting place should be looking it up in the repository from the NLM's domain-specific repositories or the NNLM's Finder. That's not all there. It can be a repository other than those. That's not all of the acceptable repositories, but that's really the starting place. Or institutional repositories or generalist repositories can also be used for data that doesn't fit in one of the specialized repositories. Some of the generalist repository approved options, now those do have to be just the approved options. Figshare, Dataverse, Zenodo, Open Science Framework are all options there. So is your institutional data repository or institutional repository, though. Those are specifically named as options. So I do recommend that your first thing to do is if you get a faculty request saying, I can't find a repository that fits, what should I do? Know whether you're going to say, I think you should use our institutional repository, or if you either don't have one or don't put data in it, we prefer to suggest that you use Figshare, Dataverse, Zenodo, Open Science Framework. Pick the one you want, Dryad if you're a Dryad member. Pick the one you want, maybe make some little text about it that describes it that you want to send them that they could discuss. And stick with one. Don't just overwhelm them with like, here's the whole list of generalist repository options. I talked longer than I should have there, so I'm not going to go through suggesting repositories here. Well, no, yes, I will, very briefly. If I have an NINDS funded researcher looking for Parkinson's, and they're doing a mix of MRIs, spreadsheets, and EEGs. I'm going to go to the NIH supported data sharing resources. This is the NLM's site. I can either go here to ICO. Remember I said that was institute or center, and pick, they've told me they're NINDS. So I can do that and browse through the descriptions here. Or I can look for subjects like, is it imaging? Remember I had MRIs, that's a type of imaging. But I also have neuroscience in here. So there's a few different options there. So I can use this to narrow down and then use my own common sense. Like, they're not doing traumatic brain injury. I said Parkinson's, so I can skip that one. And just go down to the ones where I'm not sure. They're not doing mice. But here, oh, this talks about MRIs and EEGs. I can click through and read the documentation, which my faculty member could do too, but I can save them some time by me going in and looking at some of the links and seeing if it seems to be a good fit for what they've described. There, that's a little bit shorter version. They're going to give a lot of extra stuff that I don't necessarily need to know. I need to know MRIs. I need to know EEGs. I need to know spreadsheets. Biospecimens, I can tell them to take that part out, but I need to know that there's going to be some more spreadsheets there. Ah, sorry. Reuse considerations should all come from things like data use agreements and IRBs. You cannot control this stuff. All you can do is remind them that this is reasons to limit sharing. Informed consent, restrictions by laws such as data licenses and data agreements, or technical limitations. So all you can do is kind of herd them in to say, yeah, but is that really, you can't say you don't want to do it. It's going to be one of these reasons. but you can't change those reasons for them. Oversight, element 6, oversight. Who's going to oversee compliance? Don't touch it with a 10-foot cattle prod. Tell them to talk to your Office of Research. Either the researcher is responsible for oversight, or the Office of Research is responsible for oversight, but the library isn't, and don't let them write you into it. That's the best thing I can tell you about it. This has been a very surprisingly contentious piece, and that is actually the end. But there are some good resources on my slides. Strongly recommend this new DMP course for some self-guided learning. And I always use this data curation interview manual and these data curation primers extensively in my work.
Awesome. Thank you so much, Dr. Exner. This was wonderful. I've been messing with the DMSP for a little while now, and I still learned a little bit, learned new things today. So I always appreciate that. New ways to describe information. I'm dropping one last link in the chat. You mentioned some about how, there's still things that we're figuring out and still some kind of murky areas. There's an open letter right now to NIH about this. So that might be something that people want to check out. We're right at time. I know there was a couple other questions in the chat. I don't know if we'll be able to
Let me run
go.
through some of these real fast.
Yeah.
DMSPs for secondary analysis. Ask them if they have a data license or data use agreement. Read the data license or data use agreement. Have them follow the data license or data use agreement. It's all about the license. If there's no associated publication that points to data in the repository, they should be citing their own data and using the DOI as best they can. No, there's not like a really great system to link that yet. We can hope. I actually kind of hope the open letter will help with that. Please remember that you're welcome to reach out to me and ask questions, get a quick consult or whatever. I'm happy to meet with you. Feel free to circulate the presentation internally. I didn't slap a CC BY license on it, but you're welcome to steal my slides and stuff. That's fine.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.